Hi everyone, here we are in Interactions Between Microbes and Humans, Part 2, and this is the first video. The first thing I wanted to talk about is the concept of healthcare-associated infections. You can also, so the outcome says define healthcare-associated infection and list some of the factors that make high infection rates likely in healthcare facilities. The first thing I want to clarify is that term healthcare-associated infection. You might hear it called HAI, healthcare-associated infection. You also hear these called nosocomial infections. It's the same term. It means the same thing. So you might hear either term. I'd be familiar with both. But what that means is it's an infection acquired during a stay in a hospital or healthcare facility. So they used to call them hospital-acquired infections, but they realized that this happens a lot in nursing home or rehab facilities or those kind of things. So they changed it to healthcare-associated. Let's see. So the question is list some of the factors that make high infection rates likely in healthcare facilities. So first of all, in a healthcare facility, in a hospital or nursing home, you're going to have a lot of compromised patients. You have patients that are very ill, so their immune systems are stressed. Maybe they went through surgery, so they have wounds. They might have different catheters, urinary catheters or IV catheters, and they can become infected. So there's all sorts of reasons why we would have healthcare-associated infections for compromised patients. Also, the healthcare facility might be a collection point for pathogens. Now, these pathogens might have come in with the patient themselves, so they might be their normal microbiota. But the other thing that happens is there's all sorts of different objects and surfaces, etc., that transients can also be transferred to these compromised patients. So remember we talked about the concept of fomites, and there's lots of fomites in a healthcare setting. Some of the pathogens might be in the air because there's other people that have these pathogens, or on surfaces. It might be from a patient that was in that room at a previous time. Even the healthcare personnel can transfer pathogens from patient to patient. So all of these contribute to the healthcare facility being a collection point for pathogens and increasing the infection rates in a healthcare setting. And finally, there's a lot of procedures that are unique to a hospital or healthcare setting. People have indwelling catheters, and there's actually rules and regulations about how long you leave a catheter in the patient, because the longer it's there, the more likely you'll get a contaminated catheter and a resulting infection. Lots of patients are on antibiotics, so the use of antibiotics. We talked a little bit about superinfections, where patients can get an infection on top of an infection. Sometimes that's a result of antibiotic use. Patients are getting or have implants, different like heart valves or implanted knees or shoulders and things like that. So those can be sites of infections. Skin grafts or other kinds of grafts can contribute, can be connected to high rates of infections. And when you get surgery, a lot of times there's drainage tubes. And so those can, again, also be connected to hospital healthcare-associated infections. Summarize the most common healthcare-associated infections, and probably a lot of people think of pneumonia. Pneumonia is one of the more deadly types of healthcare-associated infections, and a lot of times pneumonia is a patient gets pneumonia just as a result of their immune system being stressed. They're laying in bed for a long period of time, so they might get fluid collecting in their lungs. They're not coughing or breathing very deeply, so it can contribute to getting pneumonia, but a lot of times this is due to the patient's own normal microbiota. And like I said, it can be one of the more deadly kinds of healthcare-associated infections. Gastrointestinal tract, we're going to spend a little time talking about C. diff or C. difficile, and that's one of the more common healthcare-associated infections, GI tract infections, severe diarrhea caused by this. Urinary tract infections and surgical site infections are two of the most common kinds of hospital-acquired healthcare-associated infections. And urinary tract infections are common because of the extensive use of urinary catheters. And bacteria can accumulate in them, back up into the urinary tract, and cause these UTIs. Surgical and site infections can also occur due to surgical wounds. These healthcare-associated infections may appear during the time the patient's in the hospital, but it might appear also once they leave the hospital, but still associated with the procedures done in the hospital. I wanted to give you some examples of some common healthcare-associated infections. And here's one we want to talk about Candida auris. I wanted to show you this site that I found I wanted to show you something I found on the CDC website. The CDC is the Centers for Disease Control and Prevention, and they have all sorts of great information about everything. Lots of things about disease and infectious disease and whatnot. But they're talking about drug-resistant Candida auris. One of the reasons why I wanted to show you this is this is a important healthcare-associated infection that is happening and developing in real time right now. You can see here in this says October May 2013 to December 2018, and it says this pathogen was first identified in 2009 in Asia and has quickly become a cause of severe infections around the world. Now, one of the big problems with this, first of all, Candida is yeast, and yeast is something that a lot of us carry as our normal microbiota, but this particular kind of yeast is much more drug resistant. In fact, there's 3 main groups of drugs that are used to treat yeast infections, and this one is showing resistance to all 3 groups. Here it says 90% of the isolates are resistant to at least one of the antifungal drugs used to treat it, and 30% are resistant to at least 2. So we're at the point that some of these strains of this fungus are very close to being untreatable. In 2018, there were 323 cases of this in the U.S., but they have it at level urgent for drug resistance because it, like I said, it's becoming resistant to all the drugs available. It can be carried on a patient's skin, so it can establish itself as our normal microbiota. It's kind of interesting. The section here says, the investigators still do not know why 4 different strains of Candida auris emerged around the same time across the globe. So what's happened is in different parts of the world, these new strains, these drug-resistant strains evolved, and they've all shown up in the U.S. So fortunately, the numbers are relatively low. But the reason why I'm telling you that this is something that's happening in real time is I want to show you what's happening after 2018. There's an interesting news video here from 2023, and I thought it was really good. If you want to watch it, just go Google, you can Google this title, Deadly Fungal Infection, Spreading at an Alarming Rate. But what I wanted to show you is the map down here. What we know about this pathogen, it says about 1/3 of people who become sick with C. aureus will die. Fortunately, it's not a threat to healthy people. So this is a pathogen that's infecting people in hospitals and healthcare facilities, and it typically doesn't make healthy people sick. Now, that being said, healthy people can establish this as part of their normal microbiota, and someday they'll probably become immune compromised, and especially as they age, and they will be carrying this pathogen. So it's really important for us to be aware of this and tracking it. So we said in 2018 there were about 300 what was it, 320 cases or something. Look at the numbers down here. And I have it kind of off kilter here. But in 2022, we have like New York State, Florida, Texas, California, Nevada have 500 to 1,000 cases. And all the, these darker colors are all, let's see, the lightest ones are 0 to 1 cases. But look at these all have 1 to 10. So the numbers, and 51 to 100 in some of these other states. So the numbers of these incidents has gone up dramatically from 2018 to 2022. And this is something that we're quite concerned about. The other thing to remember about when you have a pathogen that is a yeast, a fungus, that the drugs are harder to find. Remember, yeast are eukaryotes. They're similar to our own cells. So it's hard to find drugs, low toxicity drugs to treat those. So this is a concern that we have that is developing right now, and will probably increase in the years to come. So it's something to be concerned about. So some of the main points I want to make sure you remember: that Candida auris is a yeast. It's one of the more concerning new healthcare associated infections because of its drug resistance. It's only dangerous for people who are severely ill. It survives well on surfaces and skin, and about 1/3 of infected people die. So this is a pathogen to watch and be concerned about. The next learning outcome I have is to explain the role of the infection control officer in a healthcare setting. And so an infection control officer could be a nurse, a doctor, or other specially trained individual. Most healthcare facilities now are employing infection control officers, and it actually has been documented to be one of the things that has reduced the incidence of healthcare associated infections. So it's an important thing. What this person does is they implement proper practices and procedures, including what's called universal precautions. Now, I know in nursing you talk about universal precautions, and what that means is fluids from all persons in a clinical setting are potentially infectious. You don't know the status of every patient that you have. You don't know if they have any kind of infection. So the idea is you treat the fluids from all persons as if they are infected. So you try to avoid contact with one person's fluid with another person or with yourself. So that's what we call universal precautions. And so the infection control officer is going to be involved in implementing those universal precautions. They also are going to be involved in tracking outbreaks when there is maybe I don't know, for example, an infection of MRSA, methicillin-resistant Staph aureus. Where did it come from? Did it come from a particular patient? Or is it being transferred from healthcare professionals? Is it a result of not cleaning rooms adequately? So they're going to be involved in that. They're going to train workers in aseptic technique. They're going to make sure workers know how to prevent the spread of pathogens. And they're also involved in communicating with the government public health offices. And there are certain infections and certain situations that have to be reported to public health offices. So an infection control officer might do that. And that might be something that some of you might be interested in. I just thought I'd kind of point that out because it is something that is important in the day-to-day functioning in a healthcare setting. I am going to stop this video at that point and before we move to the next one.